Suri Ekajet from there, a 100-level healthcare management and nursing student of the JPTS Institute of Science, Management and Technology, in collaboration with South American University USA, Global Wales University Togo, Pan American College California. I will be presenting a brief seminar paper on the theme, the presence of hepatitis B envelope antibody in patients who have been previously screened for the surface antigen. The word hepatitis actually means inflammation. What is hepatitis B? Hepatitis B refers to inflammation of the liver caused by hepatitis B virus. It is a serious liver infection that causes inflammation, swelling and reddening that can lead to liver change. It can also be called HBV. It can cause cirrhosis, meaning hardening or scarring, liver cancer and even death. The virus is passed from person to person through blood, semen or other body fluids. It does not spread by sneezing or coughing. Hepatitis B is a contagious disease. Hepatitis B is a vaccine-preventable liver infection caused by the hepatitis B virus. It is spread when blood, semen or other body fluids from a person infected with the virus enters the body of someone who is not infected. It is a silent disease. It can live in your body for 50+ years before you have symptoms. Signs and symptoms of hepatitis B: abdominal pain, dark urine, fever, joint pain, loss of appetite, nausea and vomiting, weakness and fatigue, yellowing of your skin and the whites of your eyes, that is jaundice. Hepatitis B is highly contagious. Although the virus can be found in saliva, it does not spread through sharing utensils or skin or kissing. It also doesn't spread through breastfeeding. Hepatitis B can be spread by direct contact with infected blood, transfer from mother to baby during birth, being pricked with a contaminated needle, intimate contact with a person with HPV, oral, vaginal and anal sex, women bites, using razors, earrings or toothbrushes or any other personal items with an infected person. There is no yet treatment for acute HPV infection, but it is a vaccine-preventable infection. It is classified in the family Hepatinavirinae. It occurs as 7 distinct genotypes, designated A to G, but it is controversial as to whether the outcome of the infection is influenced by the genotype. The present guidelines addresses tests for the diagnosis and management of HPV. Because hepatitis A virus causes acute infection and chronic, and hepatitis C virus cause both acute and chronic infection, and because both are common in North America, diagnostics tests for hepatitis A virus, hepatitis B virus are included as part of the comprehensive work. The diagnosis of hepatitis B infection in any individual has important management implications, including appropriate counseling, monitoring or treating, and vaccinating family or at risk contacts. Recommended tests to investigate chronic hepatitis B infection and interpretation of results. Chronic hepatitis virus is defined by the continued presence of hepatitis B antigen in the blood for longer than 6 months. People between the age of 20 and 49 are most likely to get it. About 90% of infants and 25 to 50% children between the ages of 1 to 5 become chronically infected. In adults, approximately 95% will recover completely and will not go on to have a chronic infection. Hepatitis B diagnosis: if your doctor thinks you may have it, they will give you a complete physical exam. They will test your blood to see if your liver is inflamed. If you have hepatitis B symptoms and high levels of liver enzymes, you will be tested for hepatitis B surface antigen and antibody. Antigen and patients on the hepatitis B virus. Antibodies are protein made by immune cells. They show up in your blood between 1 and 10 weeks after exposure. If you recover, they go away after 4 to 6 months. If they are still there after 6 months, your condition is chronic. Hepatitis B surface antibody. This shows up after hepatitis B surface antigen and antibody disappears. They are what makes you immune to hepatitis B for the rest of your life. If your disease becomes chronic, your doctor might take a tissue sample from your liver called biopsy. This will tell them how severe your case is. You might also get a liver ultrasound to check on how much liver damage there is. In conclusion, a positive hepatitis B surface antigen and antibody test results means that the patient is infected and can spread the hepatitis B virus to others through blood. Therefore, it is recommended that use condom with sexual partners, avoid sharing sharp items such as razors, nail clippers, toothbrushes, and earrings or body rings. Avoid contact with blood and bodily fluids. Thank you.